Back to Twin Cities Live. You know, sadly, as we begin to age and get older, our bodies change.
Yeah.
I don't like all of it.
Well,
And
some things are good.
Some things are good. You know, some of those changes are natural and expected.
True.
You know, so not shocking. But there can be some warning signs that something just isn't right.
Okay, so today, Dr. Angela Ziebarth with Minnesota Oncology is with us. Okay, she's going to help us break down some symptoms that are often overlooked in post-menopausal women. So if that's you, we're going to have the conversations, and it might be some embarrassing terms, but we're all adults here.
Yeah, we're going to handle
Yes.
it. Yeah,
And we're
thanks
really
for being
happy that you're here.
Thank you. I'm
so
excited to be
much.
here.
Okay, so women in postmenopause, I mean, this is an area that you really love. You love helping women feel their best and do their best in that time. And it can be kind of scary as you're approaching that.
It is, and it's not, I mean, it's not a time of life that we like to talk about,
Right.
because we're feeling vibrant. We're feeling like, why do we have to dwell on on our changing? But it's super. The work that I do is exciting. The cancers that I treat are largely centered in women just after the age of menopause, and so the hard thing is that we don't really like to talk about the symptoms that surround these cancers. There's kind of a little taboo about it.
Yeah.
And so I'm excited to be here to provide a little bit of kind of lighthearted education.
This is
Yeah.
good.
And unfortunately, if I understand it, like some of these things are happening way earlier, right? I mean, people going into menopause is happening earlier, so then obviously post-menopause is happening
Well,
earlier.
and cancers just are on the increase in general,
Right.
and probably a lot because of exposures we have in day-to-day life.
Yep.
And then a lot of our eating and health habits are kind of crummy. And
Right.
so, the reality is that there are a lot of things that we need to be aware of.
Yeah, because you got like the cup, and if you just keep filling it up with all this stuff, you can end up overflowing. Okay,
right.
So some overlooked symptoms that we're going to talk about, and this is so interesting because a lot of people are thinking like, after you go through menopause, then you don't have to deal with your monthly period. And what a joy that sounds like. Because
Yeah.
a break while you're pregnant is real delightful. Okay?
Right.
But then you can end up having some bleeding, and that's a sign that something might be off.
This is right. So once you are a year out from your last period, so if it's been a year, you haven't had a period, if you have any bleeding, even a spot, it is not normal.
Wow.
It is not normal. And I think that, we don't necessarily think about that. We don't talk about it.
Because
but-
we're used to having it being part of our life.
Like this is just like was a normal thing,
Yeah.
not a normal thing anymore.
Okay.
And so if you do notice any bleeding, you want to talk to your doctor about it right away. It could be just a sign of something that is benign that you don't have to live with. Like we might be able to work with some medications or some moisturizer or something that could help you. It could be the sign that there's a cancer. This is the most common presenting symptom for uterine cancers. And so you could get an ultrasound, we can do a little office biopsy, and that information can get us enough to treat you.
Yeah.
And the lovely thing about endometrial cancer, which is a horrible cancer, is that if we catch it early, we can cure it with surgery.
Wow.
Yeah.
And you don't have all the side effects of the drugs and stuff.
Of extra treatment.
Yeah.
Right.
Yeah.
And now it's even an outpatient surgery for most of my patients. So 90% of my patients are going home the same day from their surgeries for
For a
uterine
cancer surgery?
Yes. And so it doesn't have to be big and daunting and scary. This can be something like, I got something that's a little bit abnormal. Let me go work it out because I want to know if something's wrong so that I can get it fixed.
I had no idea about this. I'm very glad to know this.
Yeah, this is all good stuff. We got more to get to as well. What about like sensations? I mean, we're talking about like any sort of spotting blood, but like what about sensations down there?
So the other cancers that we worry about that become more common with age are vulvar cancers. So cancers on the outside of the vulva.
What? I didn't even know that was happening.
It is a thing. Skin cancers. You think like their sun is not here. Why am I getting
Sun's
it?
not shining.
Well,
Right,
get your vitamin D a lot of the ways.
Right. So the most of these cancers are HPV related. So it's a virally induced cancers.
Okay.
But there is another part. We call them type 2. There's type 2 and type 1. But there's a whole nother type of vulvar cancer that's caused by vulvar dermatosis. So this is like itching, burning on the outside of the vulva. If you mention this to your doctor, there's a very reasonable chance they're going to say, oh, as we age, we have symptoms like this. But again, you don't have to tolerate these symptoms. It's important to discuss them, to get an exam, to have someone look and say, hey, is this normal? Is there a spot that we need to biopsy?
Yeah.
Because maybe we can just give you a little steroid cream that makes the skin condition better.
Okay.
But maybe we're missing something that's actually real bad.
So if you're going to your primary care and you're saying this and they're like, it's not that big of a deal, do you have to get a referral to come to see someone like you, or do you call and say, I suspect that something might be going on?
So our first line is going to be our normal OBGYNs.
Right.
And so you'll see your primary care doctor. Many of them can provide these services in their office. So
Okay.
they can do pelvic examination, they can do the biopsies. If they don't feel confident doing that, or it's a little outside their scope of practice, they can get us to our women's healthcare providers. So an APP or a doctor that is specialized in OBGYN to kind of start that workup. And then usually once you actually have the diagnosis of cancer, you'll get moved on to the cancer surgeons.
Okay.
And that's like what I do.
Yeah, okay.
Okay, so before all of that, let's say that you don't have any symptoms of any kind. What can women be doing right now to prevent any of this from happening?
Yes, so cancers are unfortunately more common in patients that don't doctor frequently. Sometimes that's because we don't have access to healthcare, and that stinks. More often, it's because we're busy.
Yeah.
I mean, we're busy being caregivers and caring for parents and caring for children.
Well, and sometimes after you're out of the pregnancy phase,
Yeah.
frankly, you're kind of just like, oh,
Checked
I
out.
forgot, because otherwise it's part of your life.
Right. And so staying engaged, getting an annual examination, making sure you try to eat healthfully and stay active, all of those things are really important.
Yeah, big deal. This is really helpful information.
Good.
Thank you so much. We even talked about the vulva, and you did great.
I didn't.
I'm so proud
I
of you.
always squirmed a little bit, not too much.
You got to talk about this. This is what I say to my kids. We call things the proper names in our house. We can do it in this house too. If you want to learn more about cancer treatments and providers, Minnesota Oncology is the Twin Cities' largest and only independent cancer care provider. They have more than 100 experts in 13 locations. We've met many, and they really know what they're doing, including new clinics in Maple Grove and Hudson. We have more info on TwinCitiesLive.com.
Be right back.